We have a long history, almost 30 years now, of helping adolescents and their families heal and get back to a place where they can live outside of residential treatment. And we wanted to provide families who needed more acute help. Kids who were struggling with behaviors that we wouldn't normally be able to work with in New Haven. Kids who were getting excused from other programs. Kids who needed some assessment, psychological assessment, medication stabilization, those kinds of things. And so we opened stabilization and assessment at New Haven.
At the Stabilization and Assessment House, we provide a psychological assessment that can be basic or comprehensive depending on the needs of the family and the individual student, and the type of referral question that we might have for that student. So some students may come in with testing having been done, and we might want more. We might have more questions about what's happening.
We're able to work with kids so that when things get too chaotic and their world seems too big, we get to condense it to a smaller zone, a smaller area, and a smaller group, where we get to minimize it so that they only have to deal with the things that they feel capable of dealing with. And when they're ready to do that, then it's showing us, okay, they're ready to expand their world a little bit more.
Work can be really challenging at times because they do come in feeling very broken, very sad, and very depressed. But we get to see them find themselves, find out who they are, that they have value, and that they can be different and they can be happy. And it's just really fun seeing them have that hope and leaving having that hope that they can grow.
I think as a parent yourself, it's fair to ask any kind of question that might come to mind for your child when you bring them to us. Is it safe? What are the conditions? What kind of food? What are the rooms like? What is the space that they're going to be in? Who are the other students that are there? Will the staff, are they there for their job, or are they there and will they care for my child? Those are all fair questions to ask. And as the director of the program, I'm also a parent of sons and have a daughter. And so these are things that we're always thinking about, always looking at, is not through only the eyes of a professional, but also through the eyes of a parent.